Welcome back, I Prevent followers. This is Kelsey, your resident peer prevention specialist. And today, in honor of Pride Month, I'm going to be talking about LGBTQIA Healthcare. Gender affirming care. Gender affirming care, as defined by the World Health Organization, encompasses a range of social, psychological, behavioral, and medical interventions designed to support and affirm an individual's gender identity when it conflicts with the gender they were assigned at birth. To translate, it's any form of care that empowers transgender and gender nonconforming individuals to be their most authentic selves. Be that through counseling and behavioral health services, hormone replacement therapy, or reconstructive surgeries, gender affirming care is for many both a medical necessity and a matter of life and death. Studies have shown that trans and gender nonconforming individuals who receive gender affirming care have 60% lower odds of moderate to severe depression symptoms and 73% lower odds of self-harm or suicidal thoughts. Legislation. If you were already familiar with gender affirming care, you may have seen or heard it being discussed on the news. Sadly, in recent years, as transgender populations gained more visibility in our communities, there have been nationwide efforts to ban necessary health care for transgender youth. Recently, Alabama, Arkansas, Texas, and Arizona enacted laws or policies restricting youth access to gender-affirming care and, in some cases, imposed penalties on adults trying to access this care. In addition, since January 2022, 15 states introduced a total of 25 bills that would restrict access to gender-affirming care for youth. Provisions in these bills varied considerably and include those that would criminalize or impose or permit professional disciplinary action, such as revoking or suspending licensure, on health professionals providing gender-affirming care to minors, in some cases labeling such services as child abuse. Penalize parents aiding in youth accessing gender-affirming care, permit individuals to file for damages against providers who violate such laws, and limit insurance coverage or payment for gender-affirming services, or prohibit the use of state funds for such services. Resources. With all of the bad news regarding legislation, it can be easy to feel discouraged when it comes to receiving health care or social services from places that will not only respect your identity, but also keep you safe. Fret not, there are a number of amazing organizations that are accessible to you and have your needs in mind. LA Trans Advocates is a trans and gender nonconforming run organization dedicated to trans liberation and advancing the core human rights of self-determination and expression for all trans and gender nonconforming people in Louisiana. On their website, you can access their resource list, which includes healthcare providers, crisis hotlines, support groups, and more. Crescent Care, originally founded as the No AIDS Task Force in 1983 in response to the HIV epidemic in New Orleans, has continued to grow and expand while maintaining a reputation as a reliable source of culturally competent medical care. They also have a gender clinic, the only of its kind in the South, which focuses solely on the unique care needs of trans and gender nonconforming patients. The Campaign for Southern Equality, an advocacy group for LGBTQIA populations living in the South, have compiled a directory of over 400 Southern healthcare providers who are trans-affirming. From mental health to primary care, HIV specialists, and more, the Trans in the South Guide serves as a handy and trusted resource for many. Healthcare Equality Index. So you may find yourself wondering who exactly is keeping track of which providers are safest for LGBTQIA populations nationwide. Allow me to tell you about the Healthcare Equality Index. The Healthcare Equality Index, or HEI, is a national LGBTQ+ benchmarking tool produced by the Human Rights Campaign that evaluates healthcare facilities' policies and practices related to the equity and inclusion of their LGBTQ+ patients. The HEI is released in the form of an annual report that is publicly accessible. Some of the scoring criteria include non-discrimination and staff training, and transgender and LGBTQ plus patient services and support. In 2022, a record 906 healthcare facilities participated in the HEI survey, with 82% of participating facilities earning a score of 80% or higher. That's it for now, followers. I'm Kelsey with iPrevent, and remember to like, follow, and subscribe for more content.